And yes.
So hello teams, good evening everyone. So we're celebrating our 37th National Eye Donation Fortnight program, and today is the last day of it. And so as a part of it, last year also we had this national level awareness quiz for the undergraduates, and I'm so happy that we're able to continue this year also. And hearty congratulations for the finalists. So you're already winners. So the IGMCRI, the Madurai Medical College, AJ Institute of Medical Sciences, Dayanand Medical College, and Yenapoya Medical College, and Jipmar Karaikal. So, and Viluppuram Medical College. Hearty congratulations, and I hope you have a good chance of winning. Last year, it was a very wonderful, interesting session. So, I hope this year also it will be good. So, the main aim of conducting this awareness quiz is to create some amount of awareness regarding eye donation and the need of it. Okay, so corneal blindness is one major cause of blindness worldwide, and India has the maximum number of corneal blindness. And a simple cure for this is corneal transplantation. So where do we get corneas from transplantation? We don't get it from live donors. We get corneas. We get eyeballs from deceased donors. Only after a person dies, they're able to donate their eyes. So now there are so many people who are actually willing and pledging their eyes. But still the eye donation rates are in a year compared to the death rates, we are only having 55,000 donations all over India. So this is far, far less to the actual need that we need. So almost in a year, we'll be needing around 3 lakhs. So in that, we'll be getting only 55,000. So a simple thought about eye donation during the time of death. So that is during the crucial hours after death. Within 4 to 6 hours, these eyes has to be donated, and only then we'll be able to use it. So as healthcare professionals, so all our students, like all students who are going to participate now, the viewers, you are all going to be the professional people who are going to be around these grieving family during the hours of death. So you can talk professionally to the families. You can sow the simple thought of eye donation to the families. So if everyone thinks like every one of you during your internship, if you can convince one person to donate their eyes also, it would make a large, huge difference in the need that we have. And because like, see, every medical college has at least 200 students, 100 to 200 students. And if each one of you takes this as a challenge and convince one family for eye donation, it's going to make India corneal blindness free in very few years if everybody follows this. And then that is our simple request on behalf of Aravind Eye Bank of Pondicherry. So I think I've given enough lecture about corneal blindness and eye donation. So let's go to the interesting part. So at the outset, I would like to thank IMA MSN Puducherry and Dr. Jay Vignesh for arranging all these. And from my team, Dr. Aditi, Dr. Kulhesh, and very importantly, the quiz master, Dr. Rashmita Ravishankar. And I thank my team for putting up this wonderful show. And I hope the next 1 hour is going to be a nail-biting quiz session for all of you. And as viewers also, everyone is waiting to enjoy. So all the very best teams to win the first, second, and third prizes. All the very best. Over to the quiz master.
So good evening, everyone. We have today 8 teams for the Eye Donation Awareness Quiz 2022 finals. Congratulations to all the finalists. Let me quickly introduce the teams that we have today with us. We have team 1, Dhanu Varshan and Syed Suhail from Indira Gandhi Medical College and Research Institute, Pondicherry. Team 2, Ganeshri and Bharati from Madurai Medical College. Team 3, we have Harpavit Singh Sahota and Harjit Singh Sahota from Dayanand Medical College, Ludhiana. Team 4, Yugaraghavan and Girish from Viluppuram Medical College. Team 5, Vishwa Ramesh and Mohammad Fazil from Viluppuram Medical College again. Team 6, we have Anushka Pai and Meghna Hegde from AJ Institute of Medical Sciences, Mangalore. Fayaz Mohammed and Ajmal from Team 7 from Yenapoya Medical College, Mangalore. And Team 8, we have Bhavanesh and Vetrivelan from Jipmar Karaikal. Welcome again, all of you. So I hope you're all ready with the Kahoot app. The game pin will be shared with you in a few seconds. And I hope you all have a very stable and reliable internet connection, so we can all enjoy a seamless quiz. We can begin once all of you have joined in, and join in with your respective team numbers, please. Team 1, could you please rename yourself uniformly like the rest of them? You will have to exit and enter again. All of you have entered, and we are going to begin in 3, 2, and just a second. 3, 2, and 1. Yes. So we have 4 rounds with 10 questions each. Now we are beginning round 1. So, yes. On to the first question. Iris nodules associated with cafe au lait spots, axillary freckling. Your options are leash nodules, Kippis nodules, Busaka nodules, and brush wheel nodules. The right answer is leash nodules, and you've done pretty well on this question. So leash nodules are bilateral multiple iris nodules associated with von Recklinghausen disease or neurofibromatosis type 1. As you can see in the picture, multiple iris nodules. On to the next question. In a young man with cirrhosis of liver and extrapyramidal signs, all of the following ocular findings are present except: is it Asa-Fleischer ring, sunflower cataract, anterior uveitis, or jaundice? Very well done. The right answer is anterior uveitis. And after 2 questions, team 1 is in the lead. Lots of time for everyone to catch up. So yes, the patient had Wilson's disease, and it is a rare inherited disorder that causes copper to accumulate in various organs like the liver, brain, and the eyes, and it is characterized by heparolenticular degeneration. However, there is no associated anterior uveitis. Which of the following drugs acts by contraction of the ciliary body muscle, thereby opening up spaces of the trabecular meshwork? Is it pilocarpine, etoxolol, latanoprost, or dorzolamide? Very well done. The right answer is pilocarpine. So pilocarpine is an anti-glaucoma medication. It acts both on open angle as well as angle closure glaucoma. It contracts the ciliary body muscle and changes the configuration of the trabecular meshwork, which causes the spaces of the meshwork to open up and increases the aqueous outflow. It also acts on angle closure glaucoma by contracting the sphincter pupillae muscles, and thereby it pulls the peripheral iris, opening up the angle of the anterior chamber. The next question is, what is Rizzuti sign? Is it yawning reflex on retinoscopy, localized bulging of lower lid on down gaze, oil droplet reflex on distant direct ophthalmoscopy, or a conical reflection on nasal cornea when light is shown from the temporal side? Okay, a toughie this one. Team 8 in the lead now. Rizzuti sign, as you can see, is a sharply focused conical beam of light near the nasal limbus. It is produced by lateral illumination of the cornea from temporal side and seen in patients with advanced keratoconus. The next question, most common intraocular tumor in adults is it retinoblastoma, rhabdomyosarcoma, uveal melanoma, or optic nerve glioma? Very well done. The right answer is uveal melanoma. Team 8 still in the lead. Team 1 and 6 can quickly catch up. Retinoblastoma is the commonest primary intraocular tumor in children, whereas uveal melanoma is the most common primary intraocular tumor in adults. The most common secondary, that is ocular metastasis in the eye, are from organs like the breast and lung in women and men respectively. Next question, a full-term baby at birth is myopic, emetropic, hypermetropic, or anisometropic? That's right. The right answer is hypermetropic. Team 8 is on fire, it seems. So preterm babies are myopic, and this refractive error decreases with increasing gestational age, and a full-term newborn is hyperopic at birth. Next question, what is the primary stain used as the primary colorizer in Gram staining technique? Is it safranin, Gram's iodine, carbol fuchsin, or crystal violet? Brilliant. The right answer is crystal violet. Okay, team 2 catching up. So Gram staining is a useful technique used to diagnose the causative organism in various keratitis. The primary stain used in Gram staining is crystal violet, as you know. Gram's iodine is the mordant, and the secondary stain is safranin. On to the next question. All of the following are derived from surface ectoderm except, is it the corneal epithelium, lens, iris epithelium, or conjunctival epithelium, which is not derived from surface ectoderm? Too good. The right answer is iris epithelium. Okay, team 1 ready for some competition. So the anterior iris pigment epithelium, the sphincter, as well as dilator muscles are derived from the neuroectoderm, whereas the iris stroma is derived from mesenchyme. Flexner-Winter-Steiner rosettes are pathognomonic of squamous cell carcinoma, retinoblastoma, schwannoma, or basal cell carcinoma. Okay, all of you are very fast, waiting on one more answer. Great, great. The right answer, all of you have got it right. It's retinoblastoma. Remember, fastest finger first here. You need to be fast. So flexner intestinal rosettes, apart from being a characteristic feature of retinoblastoma, can also be seen in pinealoblastomas and medullopitheliomas. Another pseudo rosette seen in retinoblastoma is the Homer-Wright rosette. All of the following muscles are supplied by oculomotor nerve except, come on, quick. Yes, another easy question. The right answer is superior oblique. Okay, team 1 still in the lead. So of course, all muscles in the all the extraocular muscles are supplied by oculomotor nerve except the lateral rectus, which is supplied by the abducens nerve, and the superior oblique, which is supplied by the trochlear nerve. And we have the mnemonic for remembering this, which is SO4 and LR6. Okay, that brings us to the end of round 1. Round 2 is called I Diagnosed It, and you will have a set of case scenarios which you have to read and decipher what the most probable diagnosis will be. A 30-year-old complains of flashes, floaters, and sudden diminution of vision following blunt trauma to his right eye. What is his most probable diagnosis? Is it exudative retinal detachment? Is it rhegmatogenous RD, fractional RD, or combined RD? Very good. The right answer is rhegmatogenous RD. Still a lot of time for the other teams to catch up. Okay, so rhegmatogenous RD, rhegma meaning a tear. So any retinal detachment caused due to a tear is called rhegmatogenous retinal detachment. And the risk factors are high myopia and ocular trauma. Symptoms include flashes, floaters, and sudden painless loss of vision. The next question, a 20-year-old with red lesions in the mouth and skin has frequent episodes of redness and defective vision in both eyes. What is the most probable diagnosis of the following? Yes, the right answer is Behçet's disease. Okay, team 6, 2, and 7, you can all quickly catch up. Just need to be fast and correct. So Behçet's disease is a chronic non-granulomatous bilateral inflammation of the eyes, and it is associated with systemic symptoms, systemic findings like oral and genital ulcers, erythema nodosa, papulopustular lesions, and pseudofolliculitis. A 21-year-old with sudden painful loss of vision in the left eye. His MRI brain shows periventricular white matter plaques. What does he have? Is it anterior ischemic optic neuropathy, neuromyelitis optica, Leber hereditary optic neuropathy, or optic neuritis? Okay, so this was a tough one apparently. And after this, we have team 8 back in the lead. Optic neuritis is characterized by sudden painful loss of vision, color vision defect, RAPD, and disc edema, and is commonly associated with multiple sclerosis, which typically shows periventricular white matter lesions on the MRI, also called Dawson's fingers. A 68-year-old has pain and redness in the left eye for 1 day. Examination shows mature cataract, shallow anterior chamber, and raised intraocular pressure. Does he have phacolytic glaucoma, lens particle glaucoma, phacomorphic glaucoma, or phacoanaphylactic glaucoma? Mature cataract, shallow anterior chamber, and raised IOP. Yes, the right answer is phacomorphic glaucoma. Phacomorphic glaucoma occurs when a swollen or intumescent mature cataract pushes the iris forwards, thereby obstructing the angle or blocking the pupil, which does not allow aqueous to reach the anterior chamber and flow out of the angle, which results in the raised IOP. Next question. A 60-year-old with sudden painless defective vision in the left eye, RAPD, and a pale fundus on examination. What is the most probable diagnosis? Is it CRVO, CRAO, retinitis pigmentosa, or diabetic macular edema? That's right. A very important diagnosis to know if you want to be an ophthalmologist. CRAO, probably the most important emergency in ophthalmology. It is caused by obstruction of the central retinal artery by cholesterol or calcific plaques. It is characterized by profound and sudden painless loss of vision and has a very typical cherry red spot at the macula, as you can see in the picture. A 35-year-old presents with pain and redness in the right eye since one day, associated with headache and vomiting. What does he have? Is it primary open angle glaucoma, acute angle closure, angle recession glaucoma, or juvenile glaucoma? Very well done, impressive. Team 8 still in the lead. Team 1 and 6 have a bit of time to catch up. So acute angle closure attack is characterized by sudden onset pain, redness due to raised IOP, corneal edema, a shallow anterior chamber, and a fixed mid-dilated pupil, all of which you can see in the picture. On to the next question. A 20-year-old using contact lens complains of itching, stringy discharge for 1 week. The most probable diagnosis is it vernal keratoconjunctivitis, giant papillary conjunctivitis, flictinular conjunctivitis, or peripheral ulcerative keratitis. Very impressive. The right answer is giant papillary conjunctivitis. Let's see how the scoreboard stands. Team 8 still in the lead. Team 1 giving very close competition. The others, come on, buckle up. Giant papillary conjunctivitis, also called as contact lens-induced papillary conjunctivitis, is characterized by hypersensitivity-related inflammation of the palpebral conjunctiva to a foreign body, which is, in this case, a contact lens. The next question, a 55-year-old presents with painful eye and defective vision. He is 15 days post-op after cataract surgery. What is his diagnosis? Is it cystoid macular edema, posterior capsular opacification, exogenous endophthalmitis, or CMV retinitis? Very well done. The right answer is exogenous endophthalmitis. Team 6 is back with an answer streak of 3. Well done. Postoperative endophthalmitis is a dreaded complication post-ocular surgery. It is characterized by marked intraocular inflammation, diminution of vision caused by perioperative introduction of microbes into the eye. Your next question, a 26-year-old male with hearing loss and night blindness. What does he have? Is it Cockayne syndrome, Bardet-Biedl syndrome, Usher syndrome, or Refsum disease? Very impressive. The right answer is Usher syndrome. It is a type of syndromic retinitis pigmentosa. Usher syndrome comprises of retinitis pigmentosa and sensory neural hearing loss. Your next question, a 30-year-old complains of a central stationary black spot and bending of straight lines. He's also on treatment for alopecia with a topical medication. What does he have? Yes, the answer is central serous chorioretinopathy. Teammate really on fire and well done. Well on your way to winning, but the other teams with tough competition. Central serous chorioretinopathy is a neurosensory detachment at the macula. It affects ages between 25 to 50. It's more common in men, and the risk factors include type A personality, smoking, steroid use, and hypertension. As we know, steroid creams are commonly used in the treatment of alopecia. That brings us to the end of the second round, and we are on to the third round. So let's lighten the mood a little bit and get ready for eye trivia. Okay, so which Indian cricketer continued playing international cricket despite losing vision in one eye? Was it Sabah Karim, Mansoor Ali Khan Patodi, Nayan Mongia, or Mohinder Amarnath? Yes, the right answer is Mansoor Ali Khan Patodi or Tiger Patodi, father of Saif Ali Khan. Despite his eye injury, he continued playing international cricket. And not only that, he went on to become the youngest test captain in the world at that time and held on to that record for quite some time until the early 2000s. Next question. When is World Eye Donation Day observed? Yes, the right answer is June 10th. And it is an important trivia for all of us to know. Teammate again in the lead. World Eye Donation Day is observed on June 10th. National Eye Donation Fortnight is observed from August 25th to September 8th of each year. Moving on to the next question. As per Indian mythology, who was the first ever eye donor who donated both his eyes to Lord Shiva? Rishi Upmanyu, Ravana, Kannappa Nayanar, or Rishi Markandeya? Okay, this is really impressive. The right answer is Kannappa Nayanar. Are you all aware of the story, or was this a fluke? Okay, team 2 is back in the game. So Kannappa Nayanar was a staunch Shiva devotee. He plucked out his own eyes with an arrow to place it on the bleeding eye of the Shivalinga. And impressed by his devotion, Lord Shiva ended up restoring vision in both of his eyes. So he is the first known eye donor as per our mythology. Who is the only ophthalmologist to have won a Nobel Prize? Is it Jules Verne, Albert Gullstrand, Charles Kellman, or Ernst Fuchs? Yes, the right answer is Albert Gullstrand. Teammate, really good job. Team 1 and 5, you can still catch up. So can team 6. Yes, Albert Gullstrand was a Swedish ophthalmologist who received the Nobel Prize for his work on dioptrics of the eye. His key invention is the very important and useful slit lamp, which is indispensable for an ophthalmologist. On to the next question. What material used in ophthalmology did Sir Harold Ridley discover inside the injured pilot's eyes in a World War II plane crash? Was it silicone, PMMA, hydrogel, or proline? Yes, the right answer is PMMA. I see team 4 and 2 catching up. Polymethyl methacrylate or PMMA is a material commonly used in the making of intraocular lenses. So while operating on pilot's eyes to remove PMMA splinters from the eye, he realized that unlike glass splinters, they did not elicit any inflammatory response and were inert inside the body. And so he fashioned intraocular lenses out of PMMA, also called as Ridley's IOL. The next question, as per Greek mythology, what is the name of the giant one-eyed monster? Is it Panoptus, Hermes, Cyclops, or Minotaur? Okay, yes, and I see 20 seconds is too much for most of you to answer the questions. You're all super fast. The right answer is Cyclops. Team 8 has an impressive answer streak of 26. Keep that going. So Cyclops or Round Eye are one-eyed monsters from Greek mythology who helped Zeus defeat the Titans. Fans of Percy Jackson would be familiar with this. Argus Panoptus is the Greek god of vision. What is common to these famous personalities that you see on your screen? Not the characters, the actors. Yes, the right answer is all of them have heterochromia. Heterochromia iridum is different colored iris within the same eye, and heterochromia iridis is different colored iris in either eye. As you can see in the picture, that is what heterochromia iridis is. Okay. Your next question, ocular myasthenia is characterized by ptosis due to antibodies against the neuromuscular junction. Which celebrity was diagnosed with this from the following? Was it Helena Bonham Carter, Forrest Whitaker, Gulshan Grover, or Amitabh Bachchan? That's right. The answer is Big B. He was diagnosed with myasthenia gravis, and as the disease is currently in remission, he does not show any symptoms at present. Justin Bieber was recently suffered inability to close his eyes with hearing loss and facial palsy. What was he diagnosed with? Hutchinson syndrome, Ramsay-Hunt syndrome, Bell's palsy, or Mobius syndrome? Very well done. All of you very good at pop culture, it seems. The right answer is Ramsay-Hunt syndrome. As you can see in the picture, Ramsay-Hunt syndrome occurs when herpes zoster affects the geniculate ganglion, causing facial palsy, and you can see him unable to close his right eye. The next question. What ocular surgery did famous pop singer Taylor Swift recently undergo? Was it SMILE, LASIK, collagen cross-linking, or phototherapeutic keratectomy, or PTK? That's right. The right answer is LASIK. Team 8 still in the lead. We have one more round to go. Taylor Swift underwent laser in situ keratomiliosis, or LASIK, for myopia correction. That brings us to the end of round 3, and we have a final round to go. It's called Connect the Dots, and it's a picture quiz. So here we go. Identify the condition based on the picture. Is it Behçet's disease, sarcoidosis, VKC, or retinitis pigmentosa? The right answer is sarcoidosis. Yes, well done, team 2 catching up. So sarcoidosis causes bilateral granulomatous uveitis characterized by mutton fat capies string of pearl vitreous exudates, and candle wax dripping appearance of vasculitis. The chest X-ray shows a lambda sign, and gallium-67 scintigraphy shows panda sign. So those were the images presented to you. The next picture, identify this procedure from the image. Yes, the right answer is couching. And what you see there was the very first cataract surgery, which was practiced first in our very own country. Couching is a process of treating cataract by pushing the lens into the vitreous cavity, thereby clearing the pupillary axis. It was first documented back in 6th century BC in India by Sushruta. Your next picture, which nerve is involved in the picture that you see? Is it the oculomotor, maxillary nerve, nasociliary nerve, or ciliary nerve? The right answer is nasociliary nerve. Herpes zoster ophthalmicus. It is the affliction of nasociliary branch of ophthalmic nerve by herpes zoster. This picture shows the characteristic Hutchison sign with the involvement of the tip of the nose, which will mean there is corneal involvement as well. On to the next question. Identify the condition from the picture. CRAO, CMV retinitis, proliferative diabetic retinopathy, or CRVO. The right answer is central retinal venous occlusion with the characteristic splash tomato appearance. Team 812 in contention. This is the splash tomato appearance of fundus in CRVO. Get ready for the next picture. What are these used for? Yes, the right answer is gonioscopy. What you saw were gonio lenses. Gonioscopy is a procedure used to visualize the angle of the anterior chamber as seen through a gonio lens in the picture. Yes, we are at the fag end of the quiz. Identify the condition from the picture. Is it white dot syndrome, Vogt-Koyanagi-Harada syndrome, frosted branch angiitis, or toxoplasmosis? Very, very impressive. The right answer is Vogt-Koyanagi-Harada syndrome. The competition is now between team 8, 1, 2, and 4. Let's see if team 5 can catch up. Vogt-Koyanagi-Harada syndrome is a bilateral granulomatous panuveitis characterized by vitiligo and poliosis, and the fundus has a characteristic sunset appearance. Identify the ocular condition, which is an adverse effect of a systemic drug, from the picture. Is it Jarisch-Herxheimer reaction, Stevens-Johnson syndrome, ocular cicatricial pemphigoid, or ophthalmia nodosa? The right answer is Stevens-Johnson syndrome. SJS, or Stevens-Johnson syndrome, is a type 4 hypersensitivity reaction to various drugs causing severe involvement of the skin and mucous membrane as well as the ocular surface. Next question, identify the condition from the picture. This should be an easy one. Is it keratoconus, siderosis, Wilson disease, or blunt trauma? Yes, the right answer is Wilson disease. This was a callback to round 1. Yes, team 8, 1, 2. Okay, this is a close competition between team 2 and team 4. As we've seen already, Wilson's disease is characterized by sunflower cataract, Kayser-Fleischer ring, as well as jaundice. So from the picture, identify which muscle is acting. Is it superior oblique and inferior rectus, superior rectus and inferior oblique, superior rectus and LPS, or superior rectus only? Right answer, yes, is superior rectus and inferior oblique. You're all a very brilliant batch. Okay, team 8 clearly in the lead. The competition now is between team 1, 2, and 4. Superior rectus and inferior oblique are the elevators of the eye. And with that, we move on to the next question. Complete the triad. And because you're all such a brilliant batch, I'm not going to help you with what the pictures are. Is the third picture pseudoexfoliation, glaucoma flecken, angle closure glaucoma, or pigment dispersion? Very well done. The right answer is glaucoma flecken. What we saw was the Vokes triad. It is seen after resolution of acute congestive glaucoma, and it comprises of a fixed mid-dilated pupil, iris atrophy, as well as glaucoma flecken, which is white spots that you can see on the lens caused by pressure necrosis due to pressing of the iris. That brings us to the end of the quiz. Hope you had an eye-opening quiz, and let's brace for the results, yes? Congratulations to team 4 for your third position. Team 1 in second place, and no surprises here. The first the runners up, a special mention to team 2 and team 5. Congratulations all of you, and well done.
So team 8 is Jipmar Karaikal, team 1 is IGMCRI,
Yes, ma'am.
and team 4 is Villupuram Medical College.
Yes, ma'am.
Can you just name them also?
Yeah. Team 2 and 5 are running. Okay. Stop screen sharing and then.
Stopped it, yes, already.
It's just stop. Okay. Yes, so we have the winners. In third position is team 4, which was Yukaragavan and Girish. I think only one of you is here, is it? Both of you are here, that's great. So congratulations on the third prize. The second prize goes to team 1, Dhanu Varshan and Syed Suhail from Indira Gandhi Medical College and Research Institute, Pondicherry. And the grand winners for today, Bhavanesh and Vetrivelan from Jipmar Karaikal. And if I remember correctly, Bhavanesh was here with us last year as well, right? And the runners up are team 2, Ganashri and Bharati from Madurai Medical College, and team 5, Vishwa Ramesh and Mohammad Fazil from Villupuram Medical College. And I think we have Vishwa here with us. Okay. Congratulations, guys. Congratulations again on your prizes. Over to Dr. Christy, ma'am.
Congratulations, team members. It was a very nice, interesting nail-biting quiz session. Though in the fag end of the quiz, I think team 8 was well in a lead. And I think next year, Bhavanesh should not be allowed to the quiz, I guess. Yes, team 8? You can unmute yourself. So hearty congratulations, Jipmar Karaikal. I think last year also you had won the first prize, right?
Yes, ma'am.
Yeah. So keep up the winning streak. And congratulations to team 1 from IGMCRI and team 4 from Villupuram Medical College and all the others. I found team 6 was having a good lead in the initial period, and then slowly they lagged behind. So probably it is all matter of fastest finger, right? Like in Kahoot, the one who says the right answer within the quickest time gets the highest points. So I hope you all enjoyed. You can unmute yourself and give your feedback also.
Words from the winners.
Some words from the winners, teammate. You want to tell anything? Did you got a leak from the quizmaster earlier itself?
No, ma'am. Actually, my junior helped me in trivia, everything, and embryology, everything. Actually, I need to thank my AP assistant professor, Dr. Nirupan. He was the one who is helping us.
Now I know where the leak came from. Yeah, that's nice. That's nice. Yeah.
Yeah, so
Teammate, yeah.
Thanks for.
Junior's name?
I'm Vetrivelan, ma'am.
Vetrivelan. Okay, okay. Congratulations. So you're put up here in Pondicherry or in Karaikal?
Karaikal, ma'am. We are in
Karaikal.
Karaikal.
Okay, good, good, good. Keep up the good work. And I heard you had a rally also, no, recently?
Ma'am, yesterday we had a rally.
Yeah, good job. And keep spreading up the message on eye donation also. And I hope you will all be the eye donation warriors in your colleges as well.
Thank
Okay.
you. Thank you, ma'am.
Yeah, thank you, teammates. And team one, words from you. You can unmute yourself. I heard Dr. Vijay Priya
It
telling
was
me
nice quiz, ma'am.
the definite winners, your professor in ophthalmology.
That's great of her, ma'am, to say like that. We are also thankful for her.
Yeah.
She's a very supporting person, ma'am.
Yeah. Good. All the best.
Like
Teammate had a very good lead. I think I was also closely watching whether team one is going to win them over. Very good, team one. And what about team four from Villupuram Medical College? You can also unmute yourself.
It's a nice quiz. We lost our network in between. We
Oh, no.
don't have 2 or 3 questions in between.
Oh, okay. So probably from next year onwards, you can come directly here physically if you are able to. So that we can make sure that network issues are not there. Good, Villupuram Medical College. Thank you so much for participating. And I want all the other teams also to unmute yourself and give us some feedback. And I mean, this quiz was actually live streaming in the YouTube, but I couldn't see many people following you all. I mean, did you ask your juniors and all? I think it should be a part of your ragging process. Everybody should have been compulsorily made to watch the quiz program. Yeah. I'm not going to come for your internal exams, so don't worry. You can unmute and talk. Yes, team 7, team 5, and team 6 from Yenapoya Medical College, right?
Team 6 is from AJ.
AJ Institute of Medical Science. Okay. From Mangalore.
We have team 3 from Ludi.
Yes. Do you have any other things to share? Everyone is feeling shy. Okay, I think we should admit Dr. Jay Vignesh.
He's already.
Yeah. Dr. Jay Vignesh, are you able to hear us? So I should thank Dr. Jay Vignesh for organizing this among the medical college students and Shiny Noble as well. So I think without them, this would not have been possible to reach out to so many people. So thank you both. Do you want to share your thoughts, Shiny Noble and Jay Vignesh?
Hello, ma'am. This is Jay Vignesh here. So first of all, congratulations to the winner teams. And so this is our second association with Aravind Eye Bank, the association. This is the second year we are conducting it. I hope so. Maybe from next year we can conduct it in a physical environment, as ma'am said. So it will be it will have a better reach, and this is not a bad reach actually. We had like 40 teams, 40 teams have registered for this, and it wouldn't be possible because we have a wide range of network, Emerson network, and as well as from Aravind Eye Hospital side also there was a lot of PR going on, and from all over India we got participants, and it was good to see so many people, from first year, second year, even though they have not, come into the third year, which is after is a third year subject. So even though they have not come in, they had the interest to participate, come and just to give a try like what is going on and for the exposure. So that was very nice, and congratulations once again, and thank you to Rashmita ma'am and Christy ma'am and Aditi ma'am, who all coordinated with MSN, and hope this association continues next year and for the coming years.
So yes, definitely, Jay Vignesh. We'll be happy to conduct this every year. And as you proposed, next year we can have a physical meet, and probably we can arrange travel allowances for the contesting participants also. And all of your teams are most welcome to visit our hospital anytime. Aravind Eye Hospital, Pondicherry warmly welcomes you. You can come for a one-day tour, or you can come for observation. We'll be happy to have you here. If you're interested in Opthal, you can join here. So we'll be happy to take you also. Like, you can have a look during your medical student time. It's period itself, not like how Opthal is. You can have a real-time experience. And this is one of the biggest eye care institutions in the whole world. And we'll be happy to have you, all the teams who have been finalists, as well as those who have registered also. Jay Vignesh, you can coordinate with them. And thank you everyone once again. So if anyone else wants to share your thoughts, we're waiting for you all.
Yeah, one last thing to add, and it is an a request, or whatever proposal, whatever it may be. It would be nice if Aravind Eye Hospital associate with us for conducting research paper submissions and much more, like CMEs and for the UG students, because CMEs and because of COVID, these people, the second year and third year, now I'm in fourth year. I'm going to complete my UG in a span of 5 months. So myself, even I haven't attended. I'm very interested in attending the CMEs, quizzes, and workshops and those things. But because of COVID, the current second year, third year batches, they don't even have the exposure of see what is a CME or what is a workshop, and their importance, attending what they get through attending those workshops or CMEs. So it would be nice if such a big institution like Aravind Eye Hospital, and with the help of MSN, we could conduct much more events like our CMEs and workshops next year.
Definitely, Jay Vignesh, you can consider this as an yes. And you can keep in touch with Dr. Aditi and Dr. Rashmita also. Decide on what topic you want. We'll be more than happy to conduct a CME or a research workshop, and we'll be happy to welcome you all. So it's not at all a problem for us. Okay.
Sure, ma'am. Thank you. Thank you so much. Thank you.
Yeah. Okay. Thank you once again, teams, and congratulations. And team one, do you want to tell anything? Okay. Okay. Sorry. I think I mistook it for an unmute symbol. Okay. Thank you all. Thank you. Bye. And Rashmita, do you want to tell bye?
Congratulations again to all the winners, and it was really nice conducting this quiz, and you all really surprised all of us with the speed with which you were answering. We clearly underestimated you, so get ready for a tougher quiz next season. And yes, I think we should end the meeting here. Thank you again. Congratulations. Good luck.